Thank you all for attending. We're here with Katerina Colon to discuss her role as an epidemiologist with the IPRO.
Thank you, Taylor, for the introduction and for the invitation for speaking at today's event. I'm really grateful and honored to be here. I'm very excited to talk about some public health issues right now, especially under this situation under the pandemic. So, hi to everyone else. Like Taylor mentioned, my name is Katarina Colon. And as a little background information on me, I was born and raised in Puerto Rico. And on 2016, I moved to New York City and I completed a master's degree in public health with a concentration in epidemiology at NYU. So during my time at NYU, I worked with various colleagues and mentors on various research projects that focused on a wide range of topics from tobacco prevention, mental health, substance use, social behavior, policy and management, you name it, everything under the umbrella of public health. And of course, a lot of statistics, because that's one of the main things that an epidemiologist does besides surveillance and whatnot. So once I graduated from NYU, I started working with IPRO, which stands for Island Peer Review Organization. It's best known for its acronym at IPRO. A lot of people don't know it by its full name. And for those who haven't heard about IPRO before, IPRO is a nonprofit organization that works with government agencies, providers, and patients to implement like innovative programs that bring policy ideas to life. So what this means that in order to do all those things, IPRO staff has a really amplified and wide range of specialists that go from physicians and registered nurses, epidemiologists and biostatisticians, a lot of health policy experts, and a lot more. So it's kind of an organization that has a lot of teamwork, and we usually work all of us together on different research projects and program evaluations and whatnot. So I am an employee from IPRO, but I am an epidemiologist embedded into the Department of Health in New York State, specifically in the AIDS Institute, in the Office of Program Evaluation and Research, which is also best known for its acronym OPER. And basically in OPER, we conduct a lot of comprehensive and coordinated program evaluations and research in multiple AIDS Institute program areas. And that also includes different areas of the AIDS Institute portfolio, which also includes drug user health, HIV, Hep C, LGBTQ, drug user health, and the list goes on and on, basically. We do kind of a little bit of everything public health wise, but in a nutshell, we specialize, we want to aim to enhance the quality of the HIV and the STD and all those topics that I mentioned, specifically also in opioid overdose prevention services. We also want to aim to enhance that quality of clinical care and service delivery systems across all New York State. So as an epidemiologist in OPER, I work in various programs within the AIDS Institute. And the main thing that I do, or at least so far, is a lot of program evaluations. I evaluate a lot of protocols. We implement data collection. We perform a very big, substantial amount of data analysis. And then we usually, what we do with all that analysis is that we present the key findings to a variety of initiatives within the Institute and within different projects and programs across New York State. So I can talk about a whole bunch of other things that go under that umbrella, but I know that we wanted to touch a little bit on topics like pandemic emergency preparedness and response, mental health, and drug user health, which those are actually my area of expertise and what I focus on since even way before working at IPRO. And I wanted to talk to everyone about what it's like to work on these areas as an epidemiologist, specifically during these, hard times. The public health field is on an incredibly high demand, as everyone knows, including the medical field as well. So I wanted to touch a little bit on what it's like and how it's different from then and now. So I was mentioning to Taylor and Matthew earlier that my first day as an epidemiologist with OPER was the same day of the first day of the state's lockdown orders to the COVID-19. So it was definitely a really weird and odd way of incorporating myself into this really big agency. The Department of Health in New York State, as you can imagine, it's like an entire world. There's so many different programs and offices within the department. So it was a little weird of a transition, but we've managed to make it work somehow from remotely and sometimes going into the office. So as I was talking to Taylor and Matthew earlier too, sometimes we are called to work or volunteer in the field where COVID testing and screening sites across New York State. And the key elements basically of the work that I do with some of my colleagues as well is to collect as much data possible so we can then identify patterns and trends across the population and then suggest possible ways of intervention or development of different programs on how to approach a situation from a public health standpoint, right? So in order for us to do that, the way that we have been able to do this now, which is not that different from the way we used to do it before, is that we have to cast a really wide net to try to collect a lot of information from individuals across all New York State. So the way we used to do it before and the best way to do it now to avoid contact is online surveys. We create a lot of surveys, and we try to run it in the majority of the population so that it's actually representative of the majority of the individuals living in New York State. So once we collect and analyze that information, then we disseminate our findings. And those are a lot of the findings that you're seeing on CDC, provide, especially during the pandemic, all these regulations on security measures that I know have been a little challenging during these times because we are learning how the new virus works. So there's a constant change in guidelines and regulations because we are learning just as much as everyone else along the way, unfortunately, right? But after we have all those findings and we disseminate them, we create a series of protocols and guides for different institutions or establishments on what measures they can take for their own safety and others, and to just try to minimize transmission or to even improve or eliminate some other public health issues that are still ongoing, even though we're not talking a lot about them because of COVID. So, for example, the HIV epidemic in New York State is just as thriving in a negative way before the pandemic. So there are still other public health issues that need just as much attention, which kind of makes it difficult to balance all these, projects and surveys and work that you have to do, because now you have to prioritize COVID, but the HIV epidemic, for example, is not waiting on COVID to go away, right? So when it comes to preparing documents and protocols for emergency, this was kind of right when I entered OPER into the AIDS Institute. There were already a whole bunch of protocols established for emergency preparedness and whatnot, and I kind of jumped into it and then just followed the regulations of the New York State Department. Previous my work at OPER, I actually worked with on a lot of research on mental health and drug user health, specifically in the youth population between the ages of 12 and 17 years old. I I have, because I still do, but I did focus on the majority of my master's degree on those two topics, because that's where my main focus and interest was. And I researched mental health, specifically mental health perception and its relationship on substance use in the youth population, because I wanted to study and further understand mental health, but coming from an angle where it's mental health perception in the youth population, because I was interested, obviously, in a bunch of studies and a bunch of research that included mental health, but the majority of that was coming from an angle that people already had been diagnosed with a mental health disorder. So a lot of studies that you can see out there are based on people who are already diagnosed. And I was interested in the perception of youth on how they perceive their own mental health and how that was influencing or not influencing at all their decision on using substances, right? And when I mention substances, this goes all across the board, from tobacco and alcohol and illicit drugs, and some of them that have been legalized in different states right now too. So that's also an interesting point that I did want to bring up. Like, when I was doing this research, it was still illegal in some states, and right now, near the time of the election, some states voted to legalize certain substances. So it's going to be really, really interesting to see how that affects public health research and public health policies going forward, right? So um, this was a very interesting study that I worked under some mentors at NYU. Some of you might even have taken classes with them. I was under the mentorship of Dr. Ray Nyora and David Abrams. They're both excellent professors at NYU in the College of Global Public Health. And during that time, I was also able to make a connection and a bridge with NYU Langone Medical Center, where I worked with under the mentorship of Scott Sherman, who's also a doctor, specifically in substance use and tobacco prevention, and Dr. Omar Shahaway, who also specialized in epidemiology specifically. During that time, I developed, alongside my two mentors, a what I call a pre-research study, which later on developed into a full research study that is still ongoing, where we focused on the difference in treatment outcomes in patients with mental illness. And it was basically a proactive outreach for smokers that were using the Veterans Affairs mental health clinics in New York City. That is still an ongoing open project, but I'm really excited to see how we managed to get all that information into a PowerPoint presentation or a report for everyone who wants to see those findings. And I bring these two experiences, these two research studies in particular, because of their focus on mental health and substance use, right? So this experience for me was key because it helped me narrow down the areas of expertise that I wanted to focus on. And in some way, it actually was all connected, and it led me to working with OPER and iPro today. I'm currently working on program evaluations and research studies that also relate to mental health and substance use, which is two of the main things that are on the rise now due to the pandemic. So it's sort of a full circle moment, or should I say a circle that isn't full yet, because there is no end of what you're learning on the field every day on these topics. But I do think it's of a very, very big significance right now, especially during COVID. A fun, well, not a fun fact, because it's not that fun. It's not good at all. But one of the things that we talked about in the office is the outstanding distribution of people reporting mental health issues due to COVID. So as of 2019, last year, the National Alliance on Mental Health Illness reported an approximate 19% of US adults reporting anxiety and depression or mental health issues in general. And as of June, the same alliance reported a 40%. So that's double the amount of residents in United States that are reporting double the amount of mental health issues, mostly in anxiety and depression and trauma and stress, specifically because of being quarantined. Um, I think this is a time where my work as an epidemiologist will definitely see some new waves, new trends, and new patterns in mental health and substance use. Um, and even though these new numbers are quite alarming, as an epidemiologist, since I've studied these trends, um, they were to be unfortunately as expected. As of 2019, 1 in every 5 adults experience mental illness, and 1 in every 25 adults experience a serious mental illness like schizophrenia, for example. 17% of the US population in the youth population also experience mental health disorders as of 2019. And now all these numbers are basically duplicating. So right now, I am actually working on 2 projects. One is it's called the ETE 2020 and Beyond project. ETE stands for Ending the Epidemic. So for those who don't know, ETE, this project is basically a 3-point plan program that Governor Cuomo created in 2014. And it's a 3-point plan addressed for treatment, prevention, and hopeful elimination of HIV epidemic throughout New York State. However, since 2014, it's definitely expanded into all the other areas of public health that need a lot more attention. That's where all the other areas of the AIDS Institute portfolio come in. And we are working on different areas such as drug user health, and in my case, LGBTQ, mental health, and substance use. And we're also doing I actually just finished running a survey on COVID impact at an agency level. So as an epidemiologist in public health, we say that we're kind of always in the middle of everything, right? It's difficult for me to pinpoint a specific type of job that you're gonna do, because we're kind of everywhere, in every single area of public health, where we develop the policies, we implement new interventions, we do data collection, we do the analysis. So we're almost everywhere and all over the place when it comes to all the areas of public health. But I also say that the good thing about this field in specifics is that this is a group effort. So there's no such thing in public health as one person doing all the job, right? We need to collaborate. So we have tons and tons and tons of specialists that all come together as a group to try to capture trends that are affecting individuals' lives on a daily basis. And I think that's one of the good things about epidemiology, that you know how to do statistics, but you also know the how to deal with infectious diseases. And you also know the medical background of a disease and how you can apply it for future interventions. So it's a very well-rounded career. I'm not sure how many of you right now are looking forward to become an epidemiologist, or on your way, or interested in doing anything public health career. But the one advice that I guess I can give you is it's very rewarding, right? Because when you work as an epidemiologist, and even as a public health in general, like a public health professional, you get to see all these different little factors that affect how the world works around you and how people receive healthcare. And you see all these little details that, even though we've come a long way, there still needs to be a lot of work done, specifically because of all the socioeconomic status and all the other social determinants of health that affect individuals receiving healthcare. Um, I am one of those individuals who thinks healthcare um, is a right. It shouldn't be a privilege because, regardless of all those barriers that define us in society, we're all still humans and we all need healthcare. So, it's very important for me as an epidemiologist to bring that sort of mindset when I'm doing all my work so that we can be inclusive, so that we can provide healthcare and new ideas and new ways for people to access healthcare, especially nowadays where we have so many different groups in society that basically categorize themselves, but they're still a part of society, right? So for those who want to follow a career as an epidemiologist, I highly encourage it. And I definitely say it's a really tough position. It is hard. You have to work a lot, but it's very rewarding. And along the way, you meet a lot of people who have 20 and 30 years of knowledge and experience in these fields. And it's completely mind blowing. I'm a fairly, I call myself sort of a fairly new in the field, even though I've done almost, wow, almost 10 years of research by now. So I do have a lot more knowledge on research, and even before my master's and getting my degree, I was working on public health and I didn't even know it. Um, I did a bachelor's degree, which is basically a pre-med. I wanted to go to medical school at the beginning, but then I found the research world and fell in love with it and everything that you can do and everything that you can discover, because that was really important for me as a professional. A lot of people think that public health, specifically epidemiologists, we just sit in a cubicle and do numbers and do words, and that's not true. It's a very dynamic. You definitely have a lot of hours where you have to sit down and do numbers and create surveys and do program evaluations. It's part of it, right? But outside of the pandemic world, you get to come in contact with all these individuals from all different levels of society, and it kind of opens up your mind on a professional and on a personal level. So it's very rewarding. It's very challenging and very dynamic, but very fulfilling.